We are going to start your new year, your new decade off with a bang. Tana and I are going to do a 6-week live class. So starting January 21st, every Tuesday, we're going to be with you for an hour. And at the end, we're going to give away over $20,000 in prizes. We look forward to helping you kick off this new year by becoming brain health revolutionaries.
Welcome back. We are still here with our friend, Dr. Kabran Chapek, and we're talking about his book, Concussion Rescue. Such interesting conversation through this week, just about, how many people get in head injuries and don't know it, aren't treated for it, aren't properly treated for it, and are walking around with the effects of head injury. I was one of them, so I understand. And it's just astounding, but there's hope and there's help. And so we're talking about some of the risk factors, but also what you can do. And I'm so excited, not just about your book, Dr. Chapek, but about the course. There's just something about that I think is going to be really helpful to people to walk them through with you holding their hand. So I'm excited about that.
Thank you.
So we sort of ended on D in Bright Minds, diabesity, and how critical it is. Because if you're overweight, you automatically have 4 of the 11 Bright Minds risk factors.
Yeah.
If you're overweight, you have more inflammation because belly fat actually produces inflammatory adipokines that increase inflammation throughout your whole body. Fat stores toxins. So you have more toxins and you have lower overall blood flow to your brain, which is the study I published in normal people and in our NFL group. So working on getting your weight to a healthy level. I love this. I have this new story. I'm seeing the son of a very famous bad guy. And it's just been 2 months. He's lost 30 pounds because he just does everything I ask him. I love that. Those are the people who get better.
But you're bringing up a good point because so many people think that when we talk about weight, we're body shaming. No, it's not about that. It's about your health. And weight isn't easy for everyone to lose. But if you're having trouble with your weight, you need to be checked out. And I personally think that you need to be checked out on multiple levels. Biological, obviously, to see if your hormones and everything else, your
or
nutritional.
Head injury.
Right. So biological, psychological, if you've got a lot of excess baggage from the past, you need to, deal with that. Social, your social circles matter when it comes to your weight because people are contagious. So weight is tricky and it's not about us body shaming. It's about us wanting you to get better. And so if you're struggling with that, it's complex. It's not one thing. It's not a matter of willpower. It's way more complex than that.
But much more common in concussions and head trauma because 91% of them affect the prefrontal
and
cortex.
Hormones we just talked about.
And that leads us to S, is sleep problems become very common after head injury.
That's right. Yeah, I was actually giving a lecture at a brain injury conference about 4 years ago, and someone in the audience asked me, why do people with brain injuries always have sleep problems? And I was kind of stumped, like, okay, what's the actual mechanism? So I had to go back to the literature, look at this. One of the reasons is just less melatonin production.
I was wondering.
So there is less melatonin production. Melatonin is a hormone that can be very over the counter.
Yeah, I have to take it. And maybe, I think it was after the head injury, I can't sleep without melatonin. Like I can, but I'm fitful. I don't, it doesn't, plus the thyroid. So melatonin is and magnesium, so helpful.
So helpful.
So you're on board with this fact that you had a head injury?
Well, I am now. Didn't have a choice after I saw my brain. I'm like, it's either that or I have a really bad brain for no reason. I have this little dent in the front.
And the other reason is hypocretin. So hypocretin is it's a wake promoting hormone. So it's the reason often people are really tired after brain injury.
Interesting.
It keeps people awake. And so it's suppressed for a subset of patients after brain injury. And so often people feel, and just there's damage. And so the neurons aren't firing properly and in sequence and in series. And so it's kind of like your neighbor with their music on, and it's sort of keeping you awake at night. And then during the day, it's annoying. It's just sort of like there all the time. So the neurons aren't able to shut down when it's time to go to sleep. And they're not able to wake up fully and have good focus and memory when you're awake. So it's like
and then, another
thing.
part of that is the lower frontal lobe function. What most people don't know is the frontal lobes are in large part inhibitory. What that means is they send signals to your emotional brain to settle down.
So when you start spinning on thoughts.
And so when you take the frontal lobes offline, your amygdala and your hippocampus start screaming at you every bad thing that ever happened.
Not just that. I'm like one of those people in the middle of the night, all of a sudden, wake up. I have a list. I have like a list in my head at 4:00 in the morning.
I'm so glad you don't wake me up and tell me the list.
But I mean, I'm wondering, is that common for people who have had head injuries, like what you're saying? If that inhibitory process isn't working, are we more likely to start spinning on stuff at night?
Yes, absolutely. Yes. What about the Irlen syndrome? What I've found is it's so common in people who have traumatic brain injury.
It is.
They're light sensitive. Their depth perception's not as good. They have headaches. When they read, letters or words might move on the page or they get blurry. And wearing colored filtered lenses is so
really
helpful,
helps.
so healing. Some of my NHL players actually wear colored tinted masks when they play because their depth perception is so much better. And so I think almost anybody that's had a concussion should at least get screened for the Irlen syndrome.
100%.
And we had
100%.
Helen Irlen on a couple of times.
So interesting.
I'm like a huge fan. You just need to like do these things. And so it just, as our time comes close to an end, it's insane. And I'm a psychiatrist. I can diagnose insanity. It's insane to have a significant concussion, go to the emergency room, and then have them go, you're fine, even after a CT scan. You're fine. Just go rest.
We've seen so many people's lives destroyed from that process.
Well, it's a cause of suicide. Undiagnosed brain injuries is a major cause of suicide. It's a cause of homicide. It's a cause of homelessness. Another brand new study out, 50% of homeless people had a significant brain injury before they were homeless.
Wow.
In Toronto, that number is 58% for men and 42% for women. It's a major cause of depression, of panic disorder, as you talked about, Kabran, ADHD. And how would you know if you didn't look? There's this great study that they actually scanned people right after they had a head injury. And if their scan was normal, they had a 100% chance they'd recover well. And if their scan was abnormal, that wasn't predictive because the brain has many healing mechanisms. But 9 months later, if it's still abnormal, it predicted with a high level of certainty you're in trouble. And so that's where SPACT, I think, is the best tool because an MRI and a CT scan show structure, but they don't show function.
But wait, so you're saying after 9 months, if it still has problems, you're in trouble. But what does that mean? Does that mean that even if you didn't treat it right then, is there still hope later if someone treats it?
If they put their brain in a healing
So let's say they
environment.
didn't put their brain in a healing environment for several years, 5 years, 10 years. They suffered those consequences, but then they realize they can still be better.
In fact, in my NFL work, I treated a lot of older NFL players. Some of them were in their 60s, 70s, even 80s. And 80% of them were better 2 months later if we're doing the program that Kabran talks about in
So
Concussion
the brain's more
Rescue.
plastic than we've given it credit for.
The brain is more mendable, more moldable. Tomorrow, your brain can be better if you sleep better tonight, if you eat better today. Your brain, and it can be worse.
Right.
I did a scan of a news anchor recently, and the scan looked terrible. And I'm like looking at him like cocaine, heroin, what is this? And he got no sleep the night before. And so I'm going to scan him again to go, is his brain just terrible that we need to fix? Or was it the severe sleep?
Well, and we've seen the same thing with severe dehydration. People's their brains look terrible.
Your brain can be better tomorrow by doing the things that
I'm so
Dr.
excited about your
Chapek
program.
talks about
Thank you.
in his book, Concussion Rescue.
I'm partially so excited about it because I answer questions on social media. So many of them are people just are terrified after having a concussion and they don't know what to do. And even if you tell them what to do, it still seems a little abstract and vague to them because this is what we do. This is not what they do. And they need someone to hold their hand because they can't focus. So the daily process of holding someone's hand is just going to be critical.
And so hopefully if you're listening to this, you can just see how insane the current recommendations are. And our recommendation is immediately you put the brain in a healing environment, just as if you broke your leg.
Yeah.
It's so important. If they take the course, once the course is out, what are they going to learn beyond what we've talked about today?
They're going to learn what labs to have their doctor order for them. They're going to learn more about specific nutritional recommendations. For example, how the ketogenic diet may fit in. It's not for everybody. It's a therapeutic diet. And it can be very healing for some people. I had a patient who was a airline pilot, and he went out for drinks when he was in Australia, got punched out, and couldn't fly back. And
That's why I don't go out for drinks.
And so he was suffering for many months, and he couldn't take pills anymore. He's like, I couldn't do supplements. What's one supplement I can take that will help me? And I said, don't take any supplements, do the ketogenic diet. If you want to do one thing, let's try the ketogenic diet. And in several weeks, he had more energy. He was sleeping better. And then he was able to take the supplements and do it all. And now 2 years later, he's finally going back to work.
Yeah, it's a good point. Sometimes one step leads to another.
2 of our supplements. So if you're like, what's the least I can do? It would be 1 scoop of the Bright Minds powder.
Yeah.
Because it's called Bright Minds powder because we go after all of these risk factors. And take omega-3
Hits them
power.
all.
Take between 2 and 4 of omega-3 power and 1 scoop of the Bright Minds powder. That's where I would start. And
Absolutely.
it's that formula that I used with our NFL group. And we showed significant improvement. Well, you are a joy,
awesome.
As always.
Concussion
we love
Rescue.
You. We appreciate you.
My
I am
pleasure.
so proud of you for writing this book, for talking about it. This is just an issue. It's not going to go away in your lifetime or my lifetime. And it's a needed resource, and you are a brain warrior, and we're proud of you.
Thank you, Dr. Chapek.
Thank you so much. You're both inspirations to me, and thank you so much for having me on. It's been an honor.
Thank you.
It's an honor to work with you.
Great. All right. Brain Warriors Way podcast. Stay with us.
If you're enjoying the Brain Warriors Way podcast, please don't forget to subscribe so you'll always know when there's a new episode. And while you're at it, feel free to give us a review or 5-star rating, as that helps others find the podcast.
If you're considering coming to Amen Clinics or trying some of the brain healthy supplements from BrainMD, you can use the code podcast10 to get a 10% discount on a full evaluation at amenclinics.com or a 10% discount on all supplements at brainmdhealth.com. For more information, give us a call at 855-978-1363.